If you are over 60 and every time you think about mouth fluids and smell, you feel a little embarrassed, a little flushed in the face, then this video is a private conversation just between you and me. It is not a lecture, and it is not a class. It is simply one doctor and one grown man talking honestly with each other. I am Dr. Laura Bennett, a urologist and men's health specialist, and what I am about to share with you is something most men never hear from a doctor in their entire lifetime, especially men of your generation who grew up in a very private environment where intimacy was only whispered about in the bedroom, not discussed openly in a clinic. I understand very clearly the real fears that hide behind that embarrassment. The fear that you are dirty. The fear that if you touch, you might hurt your partner. The fear that your body is no longer as masculine as it once was. So you avoid intimacy, just so you do not have to feel weak. Let me ask you a very direct question. Have you ever rejected your partner's body simply because of her fluids? Sometimes you may not say anything out loud, but you hesitate, you pull away, or you drop a careless comment that makes her feel hurt. And from that moment on, both of you go quiet. I want you to remember one thing: intimacy does not retire, and passion does not have an age limit. The only thing that can shut it down too early is shame, misunderstanding, and false beliefs about a woman's body. In this video, I am going to show you 5 silent mistakes that slowly kill intimacy in older men. Mistakes that you may be making without even realizing it. And I will give you a very simple 3-step plan so that you and your partner can feel safer, closer, and more comfortable with each other. If you care about your health, your confidence, and your intimate life after 60, please hit the like button, subscribe to Men Over 60 Vitality, and leave a comment telling me where you are watching from, whether it is a busy city, a quiet, small town, or a peaceful retirement community. Now let us begin. Men in their 50s, 60s, and 70s walk in, one by one, sit down in the chair, take a deep breath, and repeat the same sentences so often that I could almost recite them by heart. Doctor, it feels like my body is betraying me. Or, it was. Never like this before, now I am just not the same. They talk about weaker erections, getting tired more quickly, and desire that comes and goes. They worry about their heart, their blood pressure, their blood sugar. But there is one very sensitive area that almost nobody dares to touch: fluids, smell, oral intimacy, and how they truly feel when they are close to their partner's body. The most important things are often the things that are swallowed down into silence. Behind that silence, there is usually a huge misunderstanding that many generations of men have carried. They believe that every discomfort in intimacy is caused by age, that being old just means it is like this now. Or even worse, they believe the problem is the woman, thinking maybe she is not clean or maybe there is something wrong with her down there. When a man believes this, he starts to withdraw. He touches less, hugs less, talks less, and stops looking directly at what is really happening. The woman quietly asks herself, am I really that terrible? Is my body disgusting to him? No one explains anything to anyone, and the distance between two people who used to be so close grows thicker and thicker. I want to gently turn that picture around for you. The truth is that in many cases, 80 to 90% of the problems in intimacy do not come from age the way you think they do. They come from habits and from the way we think, the way you speak or do not dare to speak about her body, the way you take care of your own body, from diet, hygiene, and medical checkups to your overall lifestyle, the way you react when you notice a strange smell, a change in fluids, or a different sensation that you do not understand. All of these are things that can be adjusted, can be relearned, and can be done differently if you are willing to give yourself the chance to look honestly and to change. After many years of working with men over 60, I have seen a very clear pattern. Most of them are not lacking in love, and they are not lacking in desire. What they lack is a mature language to talk about these issues and a safe space to ask the questions they are afraid will make them sound vulgar or strange. They are stuck between shame and silence. No one ever taught them that. In intimacy, biology, emotions, and daily life are always tightly woven together. Biology is hormones, glands, fluids, smells, moisture, and the way the tissues change with age. Emotion is shame, fear of being judged, fear of causing pain, fear of no longer being a real man. Daily life is diet, medications, chronic conditions, sleep, stress, and personal habits. If you only see one detail like this smell is unpleasant, there is too much fluid, or my erection is not as strong, and you do not see the whole picture, it is very easy to draw the wrong conclusion and to react in a way that hurts both you and the person beside you. That is why in this video we are not going to talk about bedroom tricks. I am not here to teach positions or techniques. What I want to talk to you about are 5 thinking mistakes that many men are carrying around when it comes to vaginal fluids, smell and taste, feelings of clean or dirty, and the way you communicate or avoid communication when you face these things. When you change the way you see them, your behavior will naturally begin to change as well. And I also do not want to stop at theory. At the end of the video, I will give you an intimacy checklist with 3 very specific everyday steps, so that tonight, if you want to, you can begin to try a new approach with your partner, one that is safer, warmer, less awkward, and more connected. We will walk through it together, step by step, from misunderstanding to understanding, from silence to being able to whisper honestly to each other. And that is when intimacy between you two will no longer be killed by silence, but will become a deeply valuable part of your life after 60. Now we move into the main part: 5 harmful habits that many men over 60 are carrying without even realizing it. I will speak slowly and clearly, and I will always keep our 3 layers in place: biology, emotion, and daily life, so that you can see that nothing here is actually dirty. It is simply your body and her body doing exactly what they were designed to do. Mistake number 5. Thinking vaginal fluids are dirty. First, we need to be very clear about something. Vaginal fluids are not some strange liquid that appears out of nowhere. They are a sophisticated lubrication and protection system in a woman's body. Near the vaginal opening, there are glands that produce a smooth, slippery fluid that reduces friction during contact. You can think of it as an intelligent lubricating oil that allows every movement to glide more easily. A little deeper inside, there are glands, often compared to a female prostate, that add more fluid during arousal, increasing moisture and comfort. Higher up, the cervix has its own job. It produces mucus with different thickness at different times, in order to keep the internal environment stable and balanced. In terms of composition, most of this fluid is water, along with amino acids, enzymes, minerals, and gentle lactic acid. All of this works together to protect the delicate lining, support healthy bacteria, reduce friction, and lower the risk of tiny tears and infections. This is important for younger women, but it is even more important for women after 60, because as time passes, blood vessels lose elasticity, skin and mucous membranes become thinner, and the body's ability to repair itself slows down. In other words, at this age, if there is not enough lubrication every time you are intimate, her body may be enduring discomfort rather than enjoying closeness. Unfortunately, instead of seeing this as a protection system, many men react on instinct. They make a face, pull away, tease, or throw out comments like, "That looks kind of dirty," or "This is way too wet, it feels gross." You may think it is just a casual joke, but for the woman on the other side, it can cut very deep. She may feel ashamed and judged, and she may start to shrink back from intimacy. She expresses herself less, relaxes less, and stops allowing her body to respond naturally. I remember a couple in their early 60s who came to see me. The husband told me that during one intimate moment, he blurted out, "Lately, it feels kind of dirty down there." He forgot about that sentence after a few days, but from that moment on, his wife almost never initiated intimacy again. She always turned off the lights, always rushed, and always found a way to avoid deeper closeness. It was only when she sat in my office that she finally burst into tears and said, "I thought my body disgusted him, so I tried to hold back to bother him less." In terms of composition, most of this fluid is water, along with amino acids, enzymes, minerals, and gentle lactic acid. All of this works together to protect the delicate lining, support healthy bacteria, reduce friction, and lower the risk of tiny tears and infections. When you see this as a sign of health and trust instead of dirt, your attitude will be completely different, and her feelings will be completely different as well. Mistake number 4. Turning smell and taste into a big problem. There is a question that many men want to ask, but almost no one dares to say out loud. Doctor, what about the smell? What about the taste? The truth is that the smell and taste of vaginal fluids are not always the same, and that is completely normal. They change according to diet, how much water she drinks, hormones, medications, and stress levels. Just like the smell of your sweat changes after eating spicy food, drinking alcohol, or working out. If a person eats a lot of vegetables and fruit, drinks enough water, and lives in a healthy, balanced way, the overall body scent, from breath to sweat to fluids, is usually lighter and softer. In contrast, alcohol, coffee, garlic, onions, cigarettes, and a lot of processed foods can make smells stronger and harsher. During different phases of the hormonal cycle, there are times when the smell is almost neutral, and times when there is a slightly metallic note. After menopause, because of hormonal changes, the amount of fluid can decrease, the internal environment can become drier and more easily irritated, and the smell can be different from before. What matters is that change is normal. There is no single gold standard scent that every woman should match. Just like nobody expects every man to smell exactly the same after a workout, we cannot demand that all women have one identical smell. The common mistake is when a man notices a small change, maybe a stronger scent or a different texture, and turns it into a criticism or a comment that cuts deeply. She does not only hear the words, she hears the message underneath. There is something wrong with your body. What I want you to do is move from judging to observing. If there is an unusual smell together with itching, burning pain, discomfort, or a clear change in discharge, that is a medical signal, not a reason for shame or blame. In that situation, the best response is not to avoid her, but to gently encourage her to see a doctor and offer to go with her if she wants support. And before you start scrutinizing someone else's body, you can ask yourself one honest question. Have I ever really thought about my own body odor after a gym session or a night of drinking, and yet still expected someone else to be perfectly pleased and stutters? Fresh mistake number 3. Underestimating safety. One of the questions that men most often whisper is, Doctor, is it safe to swallow fluids? This is a very reasonable question, and it deserves a calm, clear answer. Not something dramatic or frightening. For healthy couples who have had full testing, who do not have sexually transmitted infections, and who are in a faithful relationship, the overall risk related to contact with vaginal fluids is usually quite low. Most of the fluid is still water, enzymes, and protective substances. However, that does not mean the risk is zero. Just like semen or blood, vaginal fluids can carry sexually transmitted infections such as chlamydia, gonorrhea, herpes, syphilis, trichomonas, and HIV. The risk is higher if one partner has an infection without knowing it, or without treatment, or if the person receiving the fluids has mouth sores, bleeding gum disease, or open ulcers. Because of this, instead of going to extremes, either saying it is absolutely safe, no need to worry, or that sounds disgusting, better avoid everything, I want you to build a new mindset. Safety does not kill feeling. Safety is the foundation that allows you and your partner to be more free and more relaxed when you are intimate. The practical way to do this is to get tested together for sexually transmitted infections, if there are any risk factors, to be honest about sexual history when starting a new relationship, and to use barriers such as condoms or dental dams. When you do not yet know each other's health history clearly, I once met a couple in their 60s who admitted to me that their bedroom had been cold for many years because both of them were vaguely afraid of infections, but neither dared to bring it up. After counseling, they decided to go for complete testing together, received clear results, and had each item explained carefully by the doctor. From that day on, they said to each other, "We are officially allowed to feel at ease." They later shared with me that they felt more comfortable, more free, and much closer, not because of any miracle, but because a vague fear had been replaced by clarity. Mistake number 2. Staying silent out of shame. Many situations begin in almost the same way. A man notices a different smell, a change in fluids, or suddenly feels curious about trying a new kind of intimacy such as oral, and immediately the thought, "this is too embarrassing," pops into his mind. So he goes quiet, he avoids, he changes the subject, he says he is tired, his back hurts, he is sleepy. To him, it is just a way to let it pass. But to her, his sudden withdrawal, his reluctance to touch, his avoidance of areas that used to be intimate carries a completely different meaning. He does not want me anymore. The result is that emotional distance grows. She does not understand why, and he does not know how to start the conversation. Meanwhile, from a medical point of view, changes in fluids after menopause, after surgery, after an illness, after starting a new medication, or after hormonal shifts are very common. And before you start scrutinizing someone else's body, you can ask yourself one honest question. Have I ever really thought about my own body odor after a gym session or a night of drinking, and yet still expected someone else to be perfectly pleased and stutters? Fresh mistake number 3. Underestimating safety. One of the questions that men most often whisper is, "Doctor, is it safe to swallow fluids?" This is a very reasonable question, and it deserves a calm, clear answer. For example, you might say, "Lately I feel that my body and your body have changed a little, and I am a bit worried that I might be making you uncomfortable. Would you be open to us going to the doctor together to make sure everything is all right?" A sentence like that does not only open the door to the clinic, it also opens another, even more important door. The door for the two of you to be honest with each other. Mistake number 1. Forgetting the power of acceptance. There is something many men do not realize. For many women, the moment a man truly accepts their entire body, including the parts that society often jokes about or criticizes, is like a supercharged medicine that is more powerful than any blue pill. When you send the message, "I do not need you to be perfect. I am not disgusted by your body. I am here with all of who you are," her nervous system is allowed to relax. She moves from a state of tension, vigilance, and hesitation into a state of ease, trust, and readiness. Biologically, that relaxation helps increase natural lubrication, reduce pain, increase pleasure, and deepen the sense of connection. Do not forget that many women carry invisible wounds from very early in life, moments when they were mocked for their smell, their shape being too wet, too dry, not attractive enough, and the countless times they compared themselves to unrealistic images on the internet. Every time you criticize or make a face, those wounds are cut deeper. But every time you are gentle, reassuring, and appreciative, another layer of healing is added. I want to invite you as a man over 60 who has already seen a lot of life to become the safe harbor for the woman beside you. A place with no criticism, no comparisons, and no shame. A place where her body is welcomed fully, not graded like an exam. And this is also the stepping stone to the emotional peak we will talk about next. You will see that acceptance is not only good for her, it is also a performance secret for you, because a man in a healthy, safe relationship with little shame almost always performs better than a man who is tense and constantly afraid of being judged. 3-step action plan. Small checklist at the end of the main section, so that all of this does not remain only in theory. I want to summarize it into 3 simple steps that you can begin to apply. The first step is the health talk, an honest conversation about intimate health. The two of you set a time to talk, not in the middle of intimacy, but at a moment when you both feel relaxed. You agree together that sexual health is part of your overall health plan. That means regular testing, speaking openly when something feels unusual, and not letting worries sit alone in either person's mind. The second step is observe and care, taking care of things as a team. Both of you work on healthier eating, drinking enough water, using gentle hygiene practices, and avoiding products that cause irritation. You both pay attention to your body's signals. When there is a persistent problem, such as unusual smell, discharge, pain, or itching, you make an appointment together as a team, rather than letting one person go alone in a cloud of shame. The third step is practice acceptance, building the habit of acceptance every day. You can actively speak words of appreciation and reassurance, replacing teasing that might hurt her. Instead of staying silent or making a face, you can choose to say, "I feel very lucky that we can still be close." Or, "Your body does not need to be perfect. The fact that it is yours is enough for me." These small sentences repeated over time create very solid ground for both of you to stand on. It is safe, it is warm, and it leaves plenty of space for passion to continue to live. Let me share a quick story with you. One of my patients, about 67 years old, came to see me for the first time and said, "I think our time is over, doctor. I also feel like things down there are kind of dirty, so I have just been avoiding everything." After that appointment, he made one change. He changed the way he saw his wife and the way he spoke to her. Instead of making a face and avoiding her, he began to say, "I still want to be close to you, and your body does not scare me. I just want both of us to feel comfortable." A few months later, they came back together. This time, his wife looked at me and said one simple but powerful sentence: "I am not afraid of my own body anymore." From the moment she felt accepted, she relaxed more, she was happier, and their intimacy returned to something like their newlywed days, even deeper now, because there was more trust. When a woman feels safe, her body and her heart open together. That is when intimacy truly comes back to life. And I want to emphasize this for you. A strong man is not someone who never feels awkward. A strong man is someone who is willing to admit that he misunderstood, who is willing to learn again, and who dares to accept fully. Whether you are 60 or 70, it is not too late to rewrite the intimate story of your relationship. Each time you choose acceptance over judgment, you are not only embracing her body today, you are also healing the many years when she believed she was not good enough. Before we finish, let us quickly review 3 key points. First, understand vaginal fluids correctly. They are a sophisticated lubrication and protection system, not something dirty or shameful. Second, normalize smell and taste. They change with diet, water intake, hormones, and medications. Most changes are normal, and anything truly abnormal belongs in the doctor's office, not in a blame game. Third, put safety, communication, and acceptance at the center. Safety gives you the freedom to relax, talking clears away, silence and acceptance is the glue that keeps two people close. Passion does not expire. What needs to change is not your age, but your habits and the way you see your own body and your partner's body. Tonight, you only need to do one small thing. Tell your partner one honest sentence of acceptance or start a gentle conversation. For example, "I want us to feel more comfortable and happier in this part of our life. Would you be open to us talking about it a little more honestly?" And please do not rush to throw money at random pills that promise instant miracles. Invest in regular checkups, testing when needed, a healthy lifestyle, and a respectful attitude in the bedroom. If this video speaks to you, please hit like, subscribe to Men Over 60 Vitality, and share it with another man who is quietly worrying about the same things. Leave a comment and tell me what you are struggling with in your intimate life, so that we can keep walking this path together. Remember, age does not define you, your habits do. Passion does not retire, and neither should you.